Hi everyone, my name is Christine Malaved. I am from Team 4 and this is our video presentation. Case scenario. A senior couple is financially dependent on a small pension and have no family. The wife reports her husband has become confused, hears voices, and wanders around the house at night. In this given scenario, the husband might be experiencing dementia. Our team will focus about dementia in relation to the community of Taylor-Massey. According to the World Health Organization, dementia is a syndrome usually of a chronic or progressive nature in which there is a deterioration of cognitive function beyond what might be expected from normal aging. It affects the individual's memory, thinking, orientation, comprehension, calculation, learning capacity, language, and judgment. Dementia is one of the major causes of disability and dependency among older people worldwide. Dementia results from different diseases and injuries that primarily or secondarily affect the brain, such as Alzheimer's disease and stroke. According to the Alzheimer's Society of Canada, there are other types or examples of dementia. The most common type is Alzheimer's disease. Other types includes young onset dementia, vascular dementia, dementia with Lewy bodies, frontotemporal dementia, mixed dementia, and limbic predominant age-related TDP-43 encephalopathy. Statistics. According to the Public Health Agency of Canada, there are more than 402,000 Canadian seniors ages 65 and older living with dementia, excluding Saskatchewan. Yearly, there are approximately 76,000 new cases diagnosed with dementia in the country. The incidence is higher among women than men. In the province of Ontario, it is estimated that close to 228,000 Ontarians are living with dementia. As Ontario's population ages, these numbers are expected to rise to 255,000 people in 2020 and over 430,000 people by the year 2038. 7% of the Ontarians diagnosed with dementia are ages between 40 and 65 years old, and about 64% of them are women. Thank you.
Hello everyone, my name is Mandeep Kaur and I'm going to talk about how to build trustworthy relationship with your client. Trust is an important element of therapeutic nurse-client relationship. According to CNO Standards of Practice Revised 2006, nurse can establish this relationship by using nursing knowledge and skills, applying caring attitude and behavior in their practice. At the core of nursing practice is the therapeutic nurse-client relationship, and it applies to all the nurses regardless of their role and practice. It has 5 components: trust, respect, professional intimacy, empathy, power. Ways to build trustworthy relationship with your client. First component, trust is critical in nurse-client relationship. Nurse can establish trust by being compassionate, spending time with the client, demonstrating active listening, and helping to advise and resolve patient's problem. In this scenario, the nurse would be empathetic to better understand this couple's situation and what client is going through. This can be achieved by actively listening to couple's health concern and complaints. Actively listening will help nurse to pick up unspoken concerns. It will also give clients someone to talk, especially if this couple has no family members and friend to lean on. After listening to their concern, nurse will follow up on their health problems by providing treatment and arranging support. Nurse would also respect their privacy and dignity. A nurse can do this by knocking at their door before entering and then also asking for permission before providing the treatment. This will help to build a good rapport with the client. The best way to build rapport with the client is who experience mental health concern is to treat them just like you would any other person. It is very important to maintain trust. If it's a breach, It is very hard to redevelop the same trust again.
Hi, my name is Christine Pareja, and I'll be discussing briefly the legislation and subsidies applicable to our group case scenario of a senior couple from Taylor-Massey in Toronto who has no family here in Canada and is dependent on a small pension. It is said that ignorance of the law excuses no one, and as nurses, we must be an advocate for our clients, making sure that they know their rights and protect them. Based on the case scenario, the wife reported that her husband is confused, hears voices, and wanders around the house at night. So the first in my list would be the Canadian Charter of Rights for People with Dementia. This is outlined from the Canadian Charter of Rights and Freedom of the Constitution Act of 1982, and this empowers the people with dementia to know all their rights and ensures that the people and the organizations support, respect, and protect those rights. As you can see at the right side of my slide is the actual downloadable PDF form from the Alzheimer's Society of Canada. This explains and enumerates the 7 rights of people with dementia. We have also the National Strategy for Alzheimer's Disease and Other Dementias Act of 2017, and this addresses all aspects of Alzheimer's disease and other forms of dementia to improve the lives of all Canadians who are affected by dementia. Some significant legislation in this case would be the Advocacy Act of 1992, we have the Protecting Canada Senior Act of 2012, and we have also the Substitute Decision Act of 1992. So in this case, the wife would be the automatic substitute decision maker for the husband's care, just in case the husband doesn't have any power of attorney, if we are just to follow the hierarchy of appointment. We also include the important legal documents for persons with Alzheimer's or dementia, which includes a durable POA or the power of attorney for healthcare or designation of healthcare surrogate. We have the living trust, living will, the DNR order, or the will. As to subsidies, the number one question that would come up into our mind would be, what can the government of Canada offer to this couple? So the government will top up or subsidize the husband's care in part or in full depending on a case-to-case basis if he is eligible. According to Dementia Care Central 2019, the financial assistance are categorized into two. We have financial assistance by source and we have financial assistance by care location. Let's take an example for this case scenario that the husband is accepted into a nursing home and he has a monthly pension of $1,000, for example. So the government will not take all the $1,000 he have to pay for the nursing home, but instead they will take only a part of it. Let's say, for example, $800 to pay for the nursing home, and the remaining $200 will still be remain to the husband to be used as his personal expense. I also compiled the financial aid directories that could be of great help to the couple for their financial matters. In this list, I also included the assistive devices program since the husband is wandering around the house at night. He is prone to injury and he might be needing any assistive devices in the future.
Hi everyone, I am Melissa and I'll be talking about the assessment tools and nursing considerations for dementia patients. According to RNAO's best practice guidelines, a healthcare provider should assess for possible dementia when a patient exhibits cognitive, behavioral, or functional changes that would affect the activities of daily living. Some of the recommended tools for dementia assessment are Diagnostic and Statistical Manual for Mental Disorders, 5th version by the American Psychiatric Association, an extensive nursing assessment mental status questions used during nurse-client interviews, mini cognitive exam which can be performed quickly to assess registration, recollection, and executive function and is appropriate for older adults with various language and literacy levels or different cultures. A mini mental status examination to measure a person's memory, orientation, language, attention, visuospatial, and constructional skill. Montreal Cognitive Assessment to assist health professionals in detection of mild cognitive impairment and is preferred for assessment of executive dysfunction. The Nisham Confusion Scale to measure levels of confusion in processing, behavior, and physiologic control. The Resident Assessment Instrument minimum data set to collect data to assist in developing and evaluating care plans for dementia patients. Early detection of dementia is vital for both patient and caregivers. With early detection, appropriate treatment can be implemented, possibly delaying the disease process and better manage symptoms. Early detection can also prompt the planning of support provision from various resources to reduce caregiver burden. Here are some of the nursing considerations: risk for trauma related to disorientation or confusion, risk for self directed or other directed violence related to delusional thinking, chronic confusion related to alteration in structure or function of the brain tissue, self care deficit or risk for falls related to cognitive impairment, retain abilities and capabilities so that we can customize care plan for patients to be able to achieve their goals, impact of dementia on caregivers to assess their ability to cope or identify possible needs of caregivers, and also to assess the social determinants such as housing, income, and education, as it may add on to the stresses of dealing with the care of loved one with dementia. Thank you.
Hi, my name is Gurjeet. I'm gonna present what resources and external partners can be helpful for the couple. So what should be done? The family can enroll in health insurance. The health insurance will help cater for bills cared about the medication and treatment of the condition. There are many options for care such as supporting housing. This will only apply if the husband is categorized as a senior. Enrolling in seniors co-payment program is yet another support program to help the family pay off for fewer prescription drugs. Healthcare Connect will also link the family with doctor who will speak who will take care of the husband. It will only apply if the husband does not have a practitioner to treat it. Active living and wellness support groups should also help the husband get some minutes of physical activity each week. The body and mind needs to get engaged. Good sleep and healthy diet should dictate how the husband responds to the condition. External partners. The family should enroll with Alzheimer's Society of Ontario, which is called ASO. ASO is also committed to help individuals with dementia and offers programs and services that improves the quality of life. iGeri Care offers free online lessons and resources for families and caregivers that face diagnosis issue. Lynn is also one of the best resources. It helps the seniors who live independent.
Hello everyone, my name is Navdeep Kaur. I'm going to present the available resources in Taylor-Massey community for clients who are suffering from dementia. In our group case scenario, the client needs health and financial assistance, including services for the wife as a caretaker. The first available resource in the community is True Davidson Acres facility. It is a long-term care facility that offers patient-centered care to the elderly in a safe and friendly environment. This facility is located at Davis Road, and they provide specialized services and behavioral support programs to the clients who are suffering from dementia and other mental health conditions. The next service is provided by the City of Toronto. Public health nurse contacts clients with dementia who are not connected to any community and health agency.
Then public health nurse provide support and referral to the dementia care facility and other available community services. The City of Toronto also provides financial help for the medical expenses and other costs to the elderly who are in financial need through the program called the Ontario Works Assistance Program. The next resource is the registration with the Toronto Safely Home Program. As mentioned in the case, the client has a symptom of wandering at night and confusion. So it is a good option for the couple. It is a national registration service designed to assist law enforcement agencies to find missing dementia patients and assist in a safe return home. The next partner is the Ontario Dementia Advisory Group. This organization was formed in 2014 with the focus is to erase the assumption that people who are living with dementia are unable to communicate their needs, their wants, and perspective. The last but not least resource for dementia patient is provided by Toronto Central Healthline. This organization have started a program in collaboration with the Center for Addiction and Mental Health in order to provide services to older adults with mental health condition to help them remain independent in their home environment. This organization is located at Danforth Avenue, and they also provide regular visits and phone call services to the seniors with mental disabilities. Thank you for listening.
Hi everyone, my name is Jennifer Sampang and I will be presenting the strategies for dementia client. There are different strategies that can be provided to the client. First off is screening and assessment. It is important that a provider provides a thorough assessment to have a proper diagnosis and provide a comprehensive treatment. Another one is a pharmacological strategy or treatment. In some cases of dementia, such as Alzheimer's, healthcare provider prescribe medications such as acetylcholine inhibitor, which will not cure dementia, but it will allow to slow down the progression of the disease. Also, there are non-pharmacological strategies that can help a client with dementia. First off is cognitive stimulation therapy, reality orientation. It's also important to have physical exercises, and there are some clients that goes with complementary therapy such as aromatherapy. It is also important to provide safety and security for a client with dementia. Enrolling in Wandering Response Service will help the client and the family. There are also devices such as Medical Alert Bracelet that can help and locate a client if they encounter or if that person wanders around. It is also important to have a thorough assessment of the house to check for safety and if the house is prepared. Also, asking neighbors and community if the patient with dementia is missing. Another strategy is communication. It is important to remain calm or stay calm when communicating with the client or the patient. Respond with brief explanation. It is important to avoid lengthy explanation to the patient. Offer corrections as suggestion, and also it is important to avoid arguing with the patient. And lastly, another strategy would be community services and support programs. Taylor-Massey has a local community center that provides exercises program and other classes that can help the patient with dementia, involving as well or enrolling to Toronto Dementia Network, or even Baker's Hospital can provide those programs for the family with the dementia client. But all in all, the best strategy is to use a collaborative, multidisciplinary, and community support for the patient. And that is the presentation of Team 4, and we hope that you guys like our video presentation. And here are the list of references that we use.